Hello everyone, today topic is iron deficiency anemia. Previous class we already discussed what is anemia. So anemia is a condition in which the RBC level decreases as well as the hemoglobin level is decreases. Due to the decreasing the level of hemoglobin, so the iron carrying capacity of the blood is decreases, thus leads to a condition that is hypoxia. So on the classification of the anemia, we know we discuss that there is a dietary deficiency that also leads to a condition that is iron, that is the dietary deficiency anemia. So in that dietary deficiency we also discuss we have learned the iron deficiency anemia. So the topic is iron deficiency anemia. So when we find the anemic conditions, the most common cause in the population we find that is iron deficiency anemia. So iron is very important. So because the iron is helpful in the hemoglobin synthesis. We know the hemoglobin is made of heme plus globin protein. So again this heme is come by the interaction of these two things, that is one of the organic compound that is present in the RBC. This is the structure of RBC, that is called protoporphyrin 9. This is a compound that is present, but when it's combined or interact with the iron, that is the absorbed iron that is taking in our food, when they interact with them, then they form heme in the presence of an enzyme that is ferrochelatase. So it is an enzyme that helps act as a catalyst. So these two things, protoporphyrin 9 plus iron, they interact with each other and they form heme molecule. So heme is very important because in hemoglobin the heme is the major role, playing the major role. That's why heme contain the iron molecule. So that's why iron is very important. Then the cause of iron deficiency anemia. So deficiency, either there is loss is there. If the blood loss is there, that also leads to a iron deficiency anemia. So blood loss two type if it is chronic, it is taking long time. So some of the bleeding in the GI tract, that just like peptic ulcer, hemorrhoids, that blood loss is carry on. So this is a long time blood loss is there, that also leads to a condition that is iron deficiency anemia. And female, we find heavy menstrual cycle is taking per month, that also leads to a condition that is the iron deficiency anemia. And another point is that is the iron demand. If our body need more iron, it is seen during the time of pregnancy and in the growth time of the female of the girls and the boys. That time body required more iron. If the demand is not fulfilled, then the condition arises, that is the iron deficiency anemia. The third point is abnormal absorptions of the iron. Suppose you are taking the amount of food, iron containing food, but it is not absorbed in our body. So that is a malabsorption is called this term. This is seen in a disease, that is the celiac disease in the GI tract. That case also iron deficiency anemia occurs. And the fourth one is that is the diet insufficiency of iron. If our diet, those you are taking, is not containing iron or insufficient iron, so that also leads to iron deficiency anemia. Next, the sign and symptom. Whatever we discuss in the anemia, the sign and symptoms are also the signs are same like iron deficiency anemia. So one is fatigue. There is a lack of oxygen supply to the tissue, that leads to a condition that is fatigue. It leads a condition that is weakness. The patients, and also cardiac output is increases, that's why tachycardia is there, palpitations, pica. It is a unusual carving to eat non-food substance just like clay, muds, that is called the pica, that is found in iron deficiency anemia. And also patient complaining of chest pain, headache, soreness of tongue. The tongue will see the soreness, and if you find in the examination of the leaf, the both corners of the leaves, there is the cracking are found. And also if we see examine the nail of the patients, then the nail blades are spoon shaped, means it is not flat, it's become spoon shaped. This condition is called choliomycosis. So these are found in iron deficiency anemia. If you go for blood examinations, if you see the RBC on the peripheral smear, you can see the normal RBC, the RBC size is reduced. So is the normal size, it's become reduced. This condition, the size is reducing, or size is decreasing, that is called the microcytic conditions. And also the color of the RBC, that is less color, the less red in color, that is called hypochromic. So both the condition is seen in RBC, that is microcytic and hypochromic, that are seen in iron deficiency anemia. So from this we come to conclude that iron is very important. So what is the daily intake of an iron for a male and the woman? So for men, the daily requirement is 8.7 milligram per day. For female, it is 14.8 milligram per day. So it is the age of 19 to 50. That time the women having the childbearing age, pregnancy will be takes place, and also the girls menstrual cycles is going on. That's why that time is demand is more. So requirement is 14.8 milligram per day. But after 50, when menopause is gone, that case the female requirement is decreases, that is 8.7 milligram per day. So this is the daily requirement. Let's have a look what are the food, what are the source of iron, the food containing more iron. So both animal and the plant contain the iron, but the animal iron, that is called heme, that is in the form of Fe2, that is a ferrous form. This the animal flesh, that is a heme iron, and that is in the chemical form is Fe2 plus, that is easily absorbed. Okay, but in the plant food, that is the non-heme iron, that is in the form of Fe3, that is not easily absorbed. So our body, both were taking the food, animal food and the plant food, but animal food containing iron is more absorbed as compared to the plant food. So it is 4 times, how much times more? So it is 4 times more absorbable as compared to the non-heme or the plant food. So those who are taking those who are non-veg, so there is the iron demand is fulfilled by their food. But those who are vegetarian, they need more iron supplement, because their iron, that is the non-heme iron, that absorption is delay. Otherwise you say the Fe3 is not easily absorbed in our stomach or in our duodenum. So after eating the food, we discuss the types of source of food. After eating the food is going to now reach to the stomach, where the breakdown processes takes place by the gastric juice and also by the hydrochloric acid. So after the digestion breakdown take over, then the absorption takes place, that is the small intestine, and the most proximal part of the small intestine is the duodenum. There the absorption of the iron takes place. So in the duodenum, the enterocytes are there, and this how the enterocytes absorb the iron we see in this picture. This is the structure of an enterocytes. Okay, so this is the apical border of the enterocytes, and this is the basal border of the enterocytes. So in the absorption process, you see in the apical border there are some receptors are there. So Fe2 plus, that is the heme iron or animal force, that is easily absorbed in our body, okay, by the receptor. And but in Fe3 we see that is not absorbed by the apical border. So what happens? So one of the enzyme, that is the vitamin C reductase, is there, that helps this Fe3 convert the Fe3 into Fe2 plus. Okay, so now Fe2 is entered by the divalent metal transporter that is present on the apical border of the enterocytes. So now this Fe2, after Fe3 reducing one ion, next is converted to Fe2, and this Fe2 now enter into the divalent metal transporter into the enterocytes, and some of this Fe2 again oxidized and became Fe3, that is ferritin form, that is stored in the enterocytes, and the Fe2 again is moved from the enterocytes toward the blood vessels. So this can escape or exist by the basal border. In the basal border also there is the transporter is there, that easily Fe2 came out from the transporter to the Fe2 form, but the Fe2 is not absorbed, cannot move to the blood vessels. So again there is hepastine is there. So one of the enzyme that is present in the basal border that convert the Fe2 to again Fe3, that is the ferric form. Now this ferric form is easily moved to the what blood vessels. But one thing is that iron cannot move by alone. So one protein that is present in the blood vessels, that is called transferrin. So transferrin has the function to carry the iron molecule, that is the Fe3 form, into the bloodstream. So the transferrin, this is the blue structure. These are the iron carrying protein molecule that is present in the blood vessels. One transferrin protein can combine with two ferric iron, two molecule of ferric iron. Then this structure move in the blood vessels, and when it's moving in the blood vessels, the 75% of this iron containing protein that moves to the bone marrow, where the further process of erythropoiesis will be takes place, and the rest 20% that will move to the liver, where again it's converted into where it's stored in the form of Fe3 or the ferritin stored in the liver. So this is all about what the iron cycle, how the iron absorption takes place in our body. So in this Fe2 is directly absorbed, but the Fe3 has to be moved in a divalent metal transporter. So if Fe2 is easily directly transmitter are there that can easily absorb, so the heme iron is more absorbable as compared to the Fe3 or the ferric iron, or it's a non-heme iron. So it is 4 times more absorbed as compared to the Fe3. So those who are taking animal food, animal source of iron, so there the chances of iron deficiency anyway is less as compared to the vegetarian. So the vegetarian have to be iron supplement in their food, because the food source they are eating, that is the plant food source, that is in the form of non-heme or the ferric form, is not easily absorbed in our body. Okay, so that's why those who are vegetarian, they have the chances of iron deficiency anemia as compared to the non-vegetarian. So this is all about iron deficiency anemia. Some of the factors are there that will be helpful for the absorptions. Duodenum is the best place, because there is the pH level we see that is the acidic, and the acidic condition is helpful for the absorption of the iron. So that's why we have doctor advised to the patients to take vitamin C as their food, to add vitamin C or the ascorbic acid in their food. So that will helpful for the absorptions of the plant iron into the body. And some of the things like tea and coffee, that will be hampers the absorption process. So after taking meal, we should not take tea, because it will be it will be reduce the absorptions, it will be reduce the process of absorption of the iron in the body. So we should take care of this thing, and we add ascorbic acid and some of the citrus food in our body, that will help for the absorption of the iron. Okay, so this is all about iron deficiency anemia, and I hope you understand from this video, and please subscribe my channel. Thank you.